Today marks the beginning of a new era for Canadians with rare diseases. After more than 2 years of consultations with stakeholders and experts right across the country, CORD is pleased to present for the first time in its entirety Canada's rare disease strategy. So, why does Canada need a rare disease strategy? Because Canada's healthcare system is basically failing the nearly 3 million Canadians with rare diseases and their families. The problem is that health and other services are fragmented across the country. Healthcare professionals receive little training in rare diseases, and frankly, patients can't access the treatments that are available. So, what's the result? Canadians with rare diseases, two-thirds of whom happen to be children, experience huge barriers, long delays to getting a diagnosis, to getting to specialists, to getting the right treatment and care, and to taking part in research and clinical trials. For example, it took Marion 6 years, 13 specialists, and 3 misdiagnoses to finally get the right diagnosis. In the meantime, she underwent 6 unnecessary surgeries. Tony's doctors didn't know that the rare tumors that led to his liver failure could have actually been treated with a readily available cancer drug. And in Joey's province, newborn screening did not include his rare disease. So sadly, they had two more boys with the same disease before his parents realized that something was terribly wrong. I mean, the fact is that 3 out of 10 children in Canada will not live with rare diseases will not live to celebrate their fifth birthday. The fundamental premise of the strategy we're proposing is that Canadians with rare diseases deserve the same level of care and treatment as patients with more common illnesses, no matter where they live in Canada. To that effect, Canada's rare disease strategy sets out 5 points of action. First, improve early detection and prevention, get the right care to the patients as early as possible, enhance the community supports, many of which are available to the patients, provide sustainable access to promising therapies, and promote innovative research. I mean, the really good news is that many of the components of the strategy already exist. We just have to make sure that they work together and there's sufficient resourcing and support. In fact, this strategy will just help Canada catch up with the more than 35 developed countries around the world that have already implemented or in the process of adopting rare disease plans or strategies. So today we're calling upon the federal, provincial, and territorial governments, along with the researchers, the healthcare providers, the educators, the employers, and the patient community to join forces to make this strategy a reality. We also want to engage all Canadians in this important dialogue because, frankly, rare diseases is a public health issue that affects everybody. Early this fall, we're going to be hosting national forums through the social media, and we're going to be traveling across Canada to talk to Canadians about the opportunities in the strategy to improve the healthcare for everybody and also to attract new research and investment opportunities. Now is the time to act, to provide hope and treatment to Canadians and their families who are impacted by a rare disease.
Bonjour, je suis Maureen Smith. En tant que Canadienne vivant avec une maladie rare depuis mon enfance, je viens ici aujourd'hui vous parler du lancement d'une stratégie qui me tient particulièrement à cœur. Pourquoi le Canada a-t-il besoin d'une stratégie en matière de maladies rares? La raison est simple. Le système de santé canadien ne répond pas aux besoins des quelques 3 millions de Canadiens atteints de maladies rares. Les services de santé sont dispersés à travers le pays. Les professionnels de la santé reçoivent peu de formation concernant les maladies rares et les patients n'ont pas accès aux traitements qui sont disponibles. Ceci veut dire que les Canadiens atteints de maladies rares, dont les 2 tiers sont des enfants, traversent des obstacles démesurés. Ils doivent faire face à de longs délais pour obtenir un diagnostic, avoir accès à des spécialistes, obtenir des traitements et soins appropriés et participer à la recherche et aux essais cliniques. Dans mon cas, en raison de ces obstacles, j'ai vu ma santé se détériorer au cours d'une période de 20 ans, jusqu'au point où j'ai dû éventuellement abandonner ma carrière. Le principe fondamental qui sous-tend la stratégie est que les Canadiens atteints de maladies rares méritent le même niveau de soins et de traitements que les patients atteints de maladies plus courantes, peu importe où ils vivent dans le pays. La stratégie canadienne en matière de maladies rares établit un plan d'action à 5 volets pour améliorer la détection précoce et la prévention, fournir des soins opportuns, équitables et fondés sur des données probantes, renforcer le soutien communautaire, avoir un accès durable aux thérapies prometteuses et favoriser la recherche innovatrice. Aujourd'hui, nous appelons les gouvernements fédéraux, provinciaux et territoriaux, ainsi que les chercheurs, les prestataires de soins de santé, le personnel enseignant, les employeurs et la communauté de patients à unir leurs forces pour réaliser la stratégie. Nous voulons aussi que tous les Canadiens participent à la discussion parce qu'il s'agit d'une question de santé publique qui touche tout le monde. En plus des patients et de leurs familles, notre système de santé et notre économie sont aussi touchés. Lorsque des patients ne sont pas correctement diagnostiqués et traités, ils reçoivent des traitements et hospitalisations inutiles et coûteuses et ne peuvent pas, avec leurs soignants, retourner au travail. Le temps est maintenant venu pour donner de l'espoir et de fournir les soins et les traitements appropriés aux Canadiens et leurs familles touchées par une maladie rare.
Let me start off by saying that I am an all too rare disease success story. Thanks to a hardworking group of parents and patients, I was given access to a life changing treatment that has allowed me to stand here before you today. Unfortunately, the story of success is not the norm, and there are millions of Canadians affected by thousands of rare and misunderstood diseases struggling for access to care. This is my story with Gaucher disease. Gaucher disease is part of a subset of rare genetic diseases called lysosomal storage disease. What this means in layman's terms is that my body, like yours, produces a fatty substrate when developing hemoglobin. Where we differ is in the production of an enzyme that repurposes this substrate, causing it to build up in my bone marrow, liver, and spleen. And for some patients with an even more rare form of Gaucher disease, it brings devastating and life threatening neurological effects. I was born in 1990, just 13 months after my best friend and sister and fellow Gaucher patient, Megan. We began developing normally, excited and adventurous young girls, but as the years passed by, our family began to notice a general malaise setting over us. We were often too tired to walk. I had the aid of a stroller until the age of 6, and have at many times since then required the use of a cane to walk. Our stomachs, due to enlarged organs, were distended, giving our skinny frames the silhouette of a woman 9 months pregnant. We were covered in fist-sized bruises, brought on by only the slightest of nudges. All of these signs, combined with the rarity of our condition and lack of understanding, led to the devastating misdiagnosis of leukemia. After a painful bone marrow aspiration that my brave sister endured on both of our behalves, our parents were given great news. It was Gaucher disease and not cancer, causing our young bodies to fail us. Not so fortunately, we then received the blow that while a groundbreaking treatment had just been developed, it was at an astronomical cost and was not yet funded by the Ontario government, and there was little to no patient support in place. This led to the birth of the National Gaucher Foundation, a national patient association who, like we are doing today, called out for support and access to care for Canadian patients struggling with this rare disease. With the help of this new treatment, 3 years after my diagnosis, my organs began to shrink, my energy began to increase, and I started on the path to a normal, healthier life. The obstacles I faced in my journey to be here with you today are all too common. The experience of rare disease is frightful, isolating, physically and emotionally exhausting for both the patients and their family. This brings us to the need for a cohesive rare disease strategy. Rare disease patients deserve speedier diagnosis, support, understanding, and most importantly, access to care, just as much as patients affected by more commonly understood and widely known diseases. I'm here today as a patient and a success story, asking for help in bringing a positive outcome like mine to 3 million Canadians who battle rare diseases. Canada's healthcare system is failing some of our fellow Canadians, and I'm asking today for your help. The time is now for a national rare disease strategy.
It's a wonderful development today, Cord's announcement of a rare disease strategy, overdue and very, very welcome. Canada is already a leader in some aspects of rare disease. The nation's identification over the last 4 years of over 100 new rare disease genes is really an internationally a leading pace. It really is a remarkable achievement. I've seen for the firsthand as a member of the Care for Rare team that did this under Dr. Kim Boycott's leadership at the Children's Hospital here, the profound impact such research has. The identification of a clear diagnosis for these families and children, and they're mostly children affected with rare diseases who've been looking for years, sometimes decades, for a diagnosis. Within a week or two, we have a diagnosis. We can tell them for the first time what the natural history and the prognosis is. Sometimes we can start new therapies. Sometimes we stop therapies that are inappropriate, painful, and even dangerous. As exciting as this is, and as great as we're doing in rare disease, we still have a lot further to go. Right now, less than half of the children and adults with rare diseases have a diagnosis. Only 1 in 10 get treatment. 90%, there are no therapies. The rare disease initiative across the country is still somewhat fragmented, not optimally synergized. So with the advent of this national strategy, we will have things such as centers of excellence for rare diseases, bringing together the research initiative, bringing better therapies, better trials for the individuals with rare disease, and optimizing the health outcomes for this vulnerable and underserved demographic. So congratulations to CORD for this initiative.
Canada is now ready to join other leading countries with a comprehensive strategy for rare diseases. We invite governments, federal, provincial, and territorial, to join with researchers, healthcare providers, patients, and other stakeholders to come together to make this strategy a reality for Canadians.